This is Aubrey and I am a second-year student nurse from BSN 2-2 at Wesleyan University, Philippines. And today, I will show you how to do the pregnancy test, Leopolds Maneuver, fetal heart monitoring using stethoscope, and postpartum assessment. Now, let's start with pregnancy test. This is Mrs. Berta Di Maculangan, a 25-year-old wife of Mr. Berting Di Maculangan. Mrs. Di Maculangan decided to go to the hospital because her period has been late for 6 days after the day she expected it to start. And this is me, Aubrey, the assigned student nurse to Mrs. Di Maculangan. We can start by identifying the patient first. Hi ma'am, may I know your name? Hello, I am Berta Di Maculangan. Okay, Mrs. Di Maculangan, I am Aubrey de Guzman and I am the assigned student nurse for you. Today, we will do the pregnancy test to confirm if you are pregnant. I will assist you to the bathroom for you to collect some urine. Mrs. Di Maculangan, you should collect a clean catch or the midstream of your urine in the specimen bottle. Once the client have collected her urine, secure it. Perform hand hygiene and wear gloves. Get the pregnancy test kit and read instructions carefully. Open the pregnancy test kit and put it on the examination table. Using a dropper, aspirate some amount of the urine from the specimen bottle and put 2 to 3 drops of urine onto the indicator area. Wait for at least 2 to 3 minutes for the results to appear on the indicator. There are 2 possible results may occur in pregnancy test. It is either positive with double line or negative with single line. In Mrs. Di Maculangan's case, the result is positive, meaning she is pregnant. Once we have done doing the pregnancy test, we can now remove our gloves and discard all materials used. Perform hand hygiene, and now you may inform Mrs. Di Maculangan about the result. Mr. and Mrs. Di Maculangan, it is confirmed that Mrs. Di Maculangan is pregnant. Congratulations! Once done, you may now document the procedure and the result on the client's record. Let us now proceed to fetal heart monitoring using stethoscope. Again, this is Mrs. Berta Di Maculangan at her 20 weeks of gestation. And this is me, the assigned student nurse for her to do the fetal heart monitoring using stethoscope. We may start by identifying the patient. Hi ma'am, may I know your name? Hi, I am Berta Di Maculangan. Okay ma'am, I am Aubrey de Guzman, the assigned student nurse. The next thing we need to do is do hand hygiene. Expose the part to be examined, keeping a cover on the other parts. Perform Leopolds Maneuver to locate the back, which is the second maneuver umbilical grip. And then, place the diaphragm of the stethoscope onto the client's abdomen where fetal back is located. Count the beat in 1 whole minute. 2 beats are equal to 1 count. Normal result is 120 to 160 beats per minute. Below or above this range indicates fetal distress. When done, assist client to get out from bed. Wash your hands. And lastly, record your findings on the client's chart or record and report your findings to the attending physician. Next to the list is Leopolds Maneuver. Again, this is Mrs. Berta Di Maculangan at her 24 weeks of gestation. Hi ma'am, may I know your name? I am Berta Di Maculangan. Hi ma'am Berta, I am Aubrey and I am the assigned student nurse to do the Leopolds Maneuver. We are doing this for us to determine the position of your baby in your tummy. Mrs. Di Maculangan, do you want to go to the bathroom first because you might feel uncomfortable later doing the procedure? No, it's okay. Assist the client to lie on bed on a dorsal recumbent. Expose the part to be examined, keeping a cover on the other parts. Do not forget to warm your hands. First maneuver, fundal grip. Face the client's head. Using both hands, palpate the fundal area. Expect to palpate a soft, irregular mass in the upper quadrant of the maternal abdomen. This determines the shape, size, mobility, and the consistency of what she feels. The limbs and shoulders contain little bone processes that move with the fetus trunk. The head is firm, hard, round, and moves separately from the trunk, and the buttocks is symmetric and feels soft. Second maneuver, umbilical grip. While still facing the patient, moves hand to the lateral sides of the abdomen. Perform this maneuver by placing the right hand on the one side of the patient's abdomen, while using the left hand to explore the woman's uterus on the right side. Repeat this step on the opposite side using the opposite hand. The fetal is smooth and firm. The extremities of the fetus should feel like protrusions and small irregularities. Third maneuver, Pollux grip. Move hands down to the lower pelvic area. Palpate the area just above the symphysis pubis to determine the presenting part. Grasp the presenting part with the thumb and fingers of the right hand. This step of the process identifies the part of the fetus that is above the inlet. Fourth maneuver, pelvic grip. Face the client's feet. Place the hands on the abdomen and point the fingers toward the mother's feet. Gently move the fingers on the both hands toward the pubis by sliding the hands over the sides of the patient's uterus. The side where the greatest resistance to the descending fingers is the location of the brow. Assist the client to get out from bed. Wash hands. Record your findings on the client's record and report your findings to your clinical instructor and to the attending physician. Lastly, the postpartum assessment. Again, this is Mrs. Berta Di Maculangan after her delivery. First, confirm the identity of the client. Hi ma'am, may I know your name? I am Berta Di Maculangan. Okay ma'am, I am Aubrey and I am the assigned student nurse to do the postpartum assessment. This is done to know if there are complications after your delivery. Provide for the client's privacy. Set the bed to a comfortable height to work and lower the side rails where you will work. Wash your hands. Check the mother's vital sign and record. Wear a clean gloves and do the breast assessment. Position the client in a supine or sitting position. Open the gown, exposing the breast to be examined. Inspect for the following: the consistency, nipple type, and integrity, swelling, redness, and engorgement, and the tenderness. And then tie the gown. Next is the uterine assessment. Expose the client's abdomen, covering the upper part and the lower extremities. Assess the tone, height, and the location of the fundus. Next is bowel assessment. Ask client whether she moves her bowel or not, or whether flatus is positive or not. Auscultate for bowel sounds, and assess for abdominal distension. Next, bladder assessment. Ask client for the voiding pattern, presence of pain or burning sensation during urination. Palpate for the bladder distension. And track fluid balance, the intake and the output. Next is lochia assessment. Assess the amount of lochia. Note time of last perineal pad change. Note for the amount of lochia on perineal pad if it's scant, small, moderate, or large. Assess the number of days of the woman has delivered her baby. The type of lochia or vaginal bleeding is based on this. Lochia rubra, 1 to 3 days, blood is in red color. Lochia serosa, 4 to 10 days, the vaginal discharges are brownish pink in color. While Lochia alba, 11 to 21 days, the vaginal discharges are yellow to white in color. Document the number and size of blood clots. Turn patient to assess for blood loss under buttocks. Remove medical gloves and do hand hygiene. Episiotomy assessment. Wear sterile gloves. Place the patient in lateral position with her back facing you. Expose the client's buttocks. Inspect for the following: the redness, edema, ecchymosis, number of stitches, consistency of discharge and approximated edges. Palpate the edges of the stitches using either of your thumb or index finger, noting for the presence of discharges from the stitches and pain upon palpation. For addition, assess for DVT by dorsiflexing the mother's foot and ask if she feels any pain. After that, dispose or arrange used materials properly. Do hand washing. Record all data in the client's chart. And lastly, refer any abnormal findings to the attending physician. That's all, and I hope you've learned something important today. Again, this is Aubrey Gail C. de Guzman, a second-year student nurse at Wesleyan University, Philippines.